I'm Natasha Kavanagh for Dubai Life TV. I'm joined today by Dr. Aqueel Ghori, who's a general surgeon at the American Hospital. Dr. Ghori, it's nice to meet you.
Hi. Thank you, same to you.
Dr. Ghori, tell me about your role here at the American Hospital.
I'm a general surgeon, trained as a general surgeon in England and subspecialty training in colorectal surgery and laparoscopic surgery.
What was the most common surgery that you performed last year?
General surgery like laparoscopic cholecystectomies, hernia repair, fissures and fistulas. But I kept my hands going on my subspecialty interest with colorectal, so doing colectomies for colon cancers and also doing breast surgeries.
You've also specialized as a colorectal surgeon. Tell me a bit about that.
In this part of the world, I'm more in terms of benign diseases of the colon cancers like fissures and fistulas and hemorrhoid and those sort of things.
How do you go about diagnosing those?
You know, we have a set of programs. Anybody over the age of 50, they will have to have some stool tests done. And if those stool tests come back positive, then they have to go screening colonoscopies.
What sort of patients do you tend to treat?
From the patient side, obviously, if they're having symptoms, they should consider talking to their doctor. And then obviously, if it is appropriate, the doctor will send it to us. If they have any strong family history of colon cancer, then please don't ignore it. If you're over 50, 51, you should have your stool test done to see if there's any blood or anything.
Are there any common surgeries that you perform that could be prevented if a patient lived a healthier lifestyle, for example? What are they and what advice would you give?
In connection to any particular systems of the disease, we can talk about cerebrovascular diseases. If you're leading a healthy life and balanced diet and exercise, you reduce your risk of having strokes and heart attack and obviously main disease of the arteries like having aneurysms. If you're talking about GI tract, which is a gastrointestinal tract, if you have a healthy lifestyle, avoiding constipation, you can avoid having fissures or hemorrhoids and things like that.
What's involved in an endoscopy?
It's about 10-15 minutes procedure. It will require you to take some bowel prep the day before. You'll be on liquid diet for 24-48 hours before that because we need the colon to be clean so that we can visualize it. And then you come in on the day of the procedure, you'll have a conscious sedation. 95% of these tests are done under conscious sedation. The beauty of this is that the colonoscopy has got both the diagnostic and the therapeutic part to it. So the diagnostic part in the sense that we can diagnose if there's any polyps or if there's any inflammation or if there's a tumor or something. And the therapeutic part is that if there's a small polyp or something, we can take that away through the same procedure.
Back to general surgery again, is there an ailment that's you seem prevalent here in the UAE?
General surgery, I'm seeing quite a bit of gallstones, anal problems like fistulas and fissures and hemorrhoids. But one thing that has really surprised in this part of the world is I do breast surgery as well, that breast cancer in young people is very common. So I think it's important that people should not ignore if they feel a lump, if they have felt anything abnormal, then please talk to your doctor.
And we have full facilities for that here?
By all means. We run one-stop breast clinic here, and that means that usually the breast assessment is a three-pronged strategy. We run that breast clinic where you will come in, you'll see the surgeon who will assess you, and at the same time you will have your imaging done in the form of ultrasound scan and mammogram, and you'll have the result straight away. You will have, if needed, you will have the biopsy done at the same time as well, although the biopsy result may not be straight away available, probably 24-48 hours.
What's the biggest challenges that a general surgeon faces on a whole?
The part is the challenge of talking, communication, and I think dealing with it when a person is sleeping, that's easy, but I think the most difficult part is to break the bad news.
What's your favorite thing about being a general surgeon?
The thanks that you get. The following day, you see somebody just coming in with acute appendicitis. The next day, you see them sitting and having something to eat, and how grateful they are.
What healthcare advice would you like to give to the people of Dubai?
Healthy lifestyle. And then certain habits, like we all know, smoking is not great for you. It can cause you problems and things. And then if you know that anything is abnormal, your body is telling you that this is not right, get it checked.
Wonderful, Dr. Ghori. It's been a pleasure.
It's a pleasure.
Thank you very much.